As the blood sugar dysregulation gets worse, it might go into sort of one of two categories. We may be experiencing sort of this low blood sugar, or our blood sugar might just be going up or spiking a lot. Some of us can have a little bit of both, where it spikes up really high and we can feel symptomatic there, or it can crash down too low and we can also feel symptomatic there, or when there's any like really intense change in our blood sugar. Hey everyone, welcome back to the Unlock the Sugar Shackles podcast. Thank you so much for joining me for another episode. I'm really hoping that today's episode is going to be helpful for you in identifying whether or not you have blood sugar issues, and perhaps where on this spectrum are you falling with these symptoms. Because our blood sugar is not just an on and off switch, like I have diabetes or I don't. That's more of the case for type 1 diabetes, but when it comes to metabolic dysfunction, pre-diabetes, type 2 diabetes, insulin resistance, all of these things exist on a spectrum. And so we could have symptoms years or decades before our doctor picks it up. And I want to arm you with the knowledge to be able to identify and recognize these issues in yourself and perhaps people you care about. So before we dive into the content for today's episode, I just want to thank our sponsor, Good Idea. Good Idea is my favorite blood sugar sparkling water that actually helps to lower the blood sugar response from your meals by 20 to 30%. You just drink 1/3 of a can before the meal, and then you drink the rest of the can with the meal, and it lowers your blood sugar response from that meal by 20 to 30%. That's it. It tastes great, it's portable, and it's a really good thing to bring when you can't control the menu, like if you go to a dinner party or something like that. It's also really normal and appropriate to be drinking a sparkling water. You don't stand out. It's not like you're chugging apple cider vinegar in the kitchen. So head to goodidea.us and use the code DaniHealth, that's DANIHEALTH, to get 10% off your first order. All right, so let's dive into some signs and symptoms of blood sugar dysregulation. How do we know if we have blood sugar issues? So, as I mentioned at the beginning, the blood sugar dysregulation, it happens on a spectrum. And so we can start to get these really early signs of issues, and we probably just think that they're normal. I at least thought that these things were part of my personality. So the first signs and symptoms that we might experience are usually when we get hungry. So if a meal is a little bit delayed, or if we are missing a meal, or maybe right before a meal, we might start to get these early signs that our body is struggling to get energy. And so that's really what these symptoms are first telling us. Our body is struggling to get energy, especially our brain. So the very first signs and symptoms might be a lot of these brain issues, like we may be dizzy, shaky, anxious, depressed, irritable. We may have brain fog, trouble thinking, trouble concentrating, feel weak or tired, have maybe heart palpitations, headaches, nausea, sweating. All of these things are signs that our body is struggling to get energy. And like I said, especially our brain. So when we're hungry, if our body is able to tap into some stored fuel like glycogen, which is just stored sugar in our liver, or our body fat, then we wouldn't feel these symptoms because our body would just be able to get that fuel because it's stored on the inside. However, this early metabolic inflexibility, usually driven by higher insulin levels, will block our body from seeing this stored energy on our body. And so it will send us all these signs so that we go get more things to eat. We also might start to experience issues with our hunger at this time as well. So instead of just feeling like, I could eat, we'll start to experience hunger that feels urgent, that feels like I need to eat right now. It might be accompanied by all of these symptoms. So feeling irritable, that's where hangry comes in, right? And we might feel urgent need to eat, and especially having cravings for carbs and sugar, or just I need to go to the next drive-through. Or like I remember my mom when we were younger, she used to say, I get edgy when I get hungry. So feeling edgy, having this sort of like difficulty with having any patience when you're hungry. So, having these symptoms with your hunger are some of the first signs of blood sugar dysregulation. And so, as it gets worse, then we're going to see more symptoms show up. And if you listen to last week's episode, I talked about how our blood sugar affects every cell, organ, and process in our body. So I kind of went from head to toe sharing some of those symptoms. And so as our issues get worse, then we're going to start to have these symptoms show up in more areas. So now the issues with our brain that went from just a little bit of brain fog or difficulty concentrating now may start to get into more of an area where we're seeing memory loss or having cognitive impairment or even Alzheimer's, which is now being called type 3 diabetes. So we may struggle with concentration, be diagnosed with ADHD, or maybe it went from having a little bit of anxiety to now we have an anxiety disorder, or we sometimes feel like lack of motivation, but now we have full on depression. So it starts to get worse and worse and hit more body symptoms. So as the blood sugar dysregulation gets worse, it might go into sort of one of two categories. We may be experiencing sort of this low blood sugar, or our blood sugar might just be going up or spiking a lot. And some of us can have a little bit of both, where it spikes up really high and we can feel symptomatic there, or it can crash down too low and we can also feel symptomatic there, or when there's any like really intense change in our blood sugar. So our body likes everything to be chill and not change too quickly. But when our blood sugar spikes very rapidly and we have that very rapid change, or when it's dropping really rapidly because we got such an insulin release and now it's all going away, we can start to feel really symptomatic on those changes. And that's why I really love glucose monitors, so continuous glucose monitors. And I love to be able to see what's happening. This can really start to help us understand how our body's symptoms are manifesting from these blood sugar issues. So, for example, one of the things that happens to me when my blood sugar spikes high is that I'll start to get cravings for sugar at the very peak of that spike, which is a very interesting thing that I don't even understand the mechanism for that. So it's interesting because we would think, okay, if my blood sugar was low and I needed to pump it back up, that would sort of makes sense for why I was craving something. But for me, it also happens at these higher numbers as well. So these cravings and this urgent hunger, again, is sort of showing up, and it can show up at any point on that blood sugar graph. So when a lot of people have these early blood sugar issues, it's really in this area of hypoglycemia. It's that their blood sugar is ticking a little bit too low, and then that's when we feel like we need to eat. So I'm not giving anybody diagnoses. I don't diagnose or treat anyone as a nutritional therapy practitioner, but I'm giving you sort of this outline to better understand where you may be at, so then you can do your research and and even confirm with looking at your blood sugar numbers, what's going on with you. So, like I said, that first pattern for many people tends to be this hypoglycemia, where their blood sugar is going too low, and then so they're driven by those symptoms to go get some fast source of energy, which would be something like stopping at the nearest drive-thru, just grabbing a granola bar, grabbing Starbucks, right? So it could be it's usually these cravings for foods that are going to give you this quick pick-me-up, aka a really quick burst of sugar into the system. And so what that is going to do is, over time, it's going to spike our blood sugar, and then we're going to get that same crash again. So over time, we're just spiking and spiking and crashing and spiking and crashing. And what this does is it starts to really increase the amount of insulin in our blood. And now when we get too much insulin, then we start to develop insulin resistance. And insulin resistance, again, is blocking our body from using that stored energy for fuel, and whether it's the glycogen in the liver or whether it's our body fat. And so it can also cause us to feel like we are never full, because what happens when there's insulin resistance, the insulin's supposed to escort the glucose out of the blood into the cells of the body so it can be used to make energy. But if the insulin is having a hard time getting that glucose into the cell, we're going to have a problem because now the sugar is in the blood where it's not supposed to be, and the cells are like, hey, I'm starving over here. You haven't given me anything to go on. So you're going to have this continued feeling of hunger because your body is seeking energy that it's not getting. It's like the energy is in the wrong place. It's like we can't access the energy that's even stored on our body. We can't get to it, or we can't make it properly. And so when we have insulin resistance, we might feel hungry all the time. We might have cravings for sweets at the end of a meal. We may have issues with our cortisol. So we may be sort of that stress type. We might be able to go for a long time without eating, but some of us may not be able to go very long without eating at all. And we may need to eat more and more frequently because our body's struggling to get that energy, right? So with insulin resistance, you can also have issues with, because insulin is a growth hormone, so we can have issues with gaining weight. We can get skin tags. We can get darkening of the skin folds on the neck and in some of these folds of our body. We can struggle with hormone issues. There's definitely going to be issues with sleep in here starting to happen. Some people are going to get woken up in the middle of the night, and usually that's from some sort of hypoglycemia, especially if you're having trouble falling back to sleep. So it's like your blood sugar might be fine during the day, but at night you'll see it drop into the red, and then that will be at the same time as these wake ups that we might see on our Oura ring. So these are some issues that are starting to happen with insulin resistance, and our blood sugar may not be affected yet. So this is where it gets kind of tricky, because it's like, how do we know if we have insulin resistance? If we're looking at our blood sugar might not be telling the story. So I'm going to go into all those numbers next week and things that we need to know. But for now, focusing back on symptoms, we may have blood sugar spikes that are swinging higher than normal. And then with all of that comes all those changes in how we feel. So again, the anxiety, the cravings, the irritability. And so as things progress, when we start to get more and more insulin resistance, for a lot of people, they may still feel like their blood sugar is crashing. But now what's happening is the whole line of your blood sugar, it starts to go higher and higher and higher. So what that means is that maybe your blood sugar was spiking up to like 140 and then crashing down to, let's say, 60. And that's happening time and time again, because when you get low, now you're eating again and it makes it go up higher again, just to give you another crash. So now what's happening is, maybe because we're getting more and more insulin in the system because we keep eating and we keep spiking our blood sugar, now maybe you're spiking up to like 160 and maybe you're only crashing down to like 75, but it still feels like this crash. And then over time, years and years of doing this, maybe you're spiking up to 200 and then you're dropping to like 110, and it's still feeling like that low for you. So I have seen this happen with my clients, that when they have this hypoglycemia and they're treating that hypoglycemia with carbohydrates, what ends up happening is that they still end up having this pattern of feeling like the spike and the crash, but that the numbers just get higher and higher and higher. So now, instead of them crashing when it's actually in a low range, let's say below 70, now what starts to happen is your blood sugar feels like it's crashing kind of in these normal ranges. So like 90 or 100. And people are questioning like, well, this can't be my blood sugar because my blood sugar is 100 right now. But this is so common. I want you to know how common this is. And this is often happening. So if you are feeling blood sugar crashes, and your blood sugars are in what we consider this normal-ish range, then what's likely happening is that there's more progressed insulin resistance, and you may be heading towards that pre-diabetic stage. And so I want to stick with this being symptomatic, but it's hard to totally separate the numbers sometimes. But it is very possible to have all these symptoms when your blood sugar is higher and still feel like it's hypoglycemia. And so there are these relative lows. It may be called postprandial syndrome. And I kind of compare this to let's say I'm standing in this room and the temperature feels fine to me. Then I go take a really hot shower for like 15 minutes. And then I come back into this room and now this room feels cold. And I'm like, ooh, I have to start putting on some sweaters and turning up the heat. Well, that's the same thing that's happening with your blood sugar. Your blood sugar is so used to being set higher that now when it goes a little bit lower, it feels like, ooh, this is too low for me. This doesn't feel good anymore because your body's new normal has now increased to being up there, right? So all this while, we can be having all sorts of symptoms. So some of these symptoms are like the ones that I said earlier, but now we're just going to get more of these symptoms. They're going to be more intense. So it might be really shaky. Our fingertips might turn blue. You may have a lot of dizziness or feel like you're going to pass out or actually pass out. Some people feel like they need to call the ambulance. Some people are going to the hospital for this, for their low blood sugar symptoms. And again, if they show up normal, guess what happens? You get gaslighting from your practitioner. This also often happens when it's combined with adrenal issues. If your adrenals are really struggling or if you have really high cortisol, it's very common that you will feel these same symptoms. So as the blood sugar dysregulation, actually, one thing I want to say is that a lot of people at any of these earlier or more progressed stages might find that they have these certain behaviors to prevent themselves from feeling low. And the reason I know this is because this was me. I never knew that I had these blood sugar issues because I was always eating to prevent them from happening, because all I knew is that I didn't like feeling hungry. I hated feeling hungry. And so it felt really, really bad in my body. And so what I would do is make sure that I was eating basically all the time, so I never had to feel hunger. And so I would wake up shaky. I would be grazing all day. I would be snacking all day. I would have food with me in my purse. I would eat before I left the house, even if it was to go out to eat. So it was like I was naturally sort of drawn towards self-medicating to make sure that I didn't feel hungry. So I also want you to know that those are some behaviors you might have. And then there's also these beliefs like, I just feel better with carbs, right? Like I can't take out carbs because I start to feel really bad. That's very common. And most people can't just take out carbs without feeling really bad. That's a whole conversation for another day. But that is a really, really common belief. And then just feeling like you're a person maybe who just like looks at a plate of cookies and feels like you gain 5 pounds. Like you just feel like your weight is just keep continuing to increase, and that even working out is no longer helping. Like doing what you used to do, you definitely know if you have blood sugar issues. If you start doing what you used to do to lose weight, like going to the gym and just watching what you eat in quotes, and it's not working, that is really a sign that this hormonal dysregulation is at the root of this problem. So as we get into prediabetes, this is when our blood sugar starts going higher, right? So you may or may not still feel these lows. Some people are just staying in this low place, and when they stabilize their blood sugar, then it just kind of goes up a little bit higher. And I've seen this, actually I saw this with 2 of my clients recently who tend to have really, really low blood sugar. They're dropping all the time, and now their blood sugar is really stabilized, but the line is like in the hundreds, 110s. And so I think that my understanding of that is that now this insulin resistance is showing up in a different way because we're stabilizing our blood sugar and we're getting all these healthy fats in. And so our blood sugar isn't dropping anymore, but now the insulin resistance is sort of manifesting as it's like, oh, now we can't get that sugar into the cell anymore. So it's a big problem. So the prediabetes is when the blood sugar starts to go higher. And this is just where we're going to start to see more metabolic damage. We're going to start to see things that your doctor doesn't like, oh, my triglycerides are high, my HDL is low, my LDL is getting higher, my blood pressure is getting higher. low blood sugar, it can cause low blood pressure, just so you know. But then as it gets higher, we tend to see higher blood pressure start happening. We start to see the cholesterol numbers go up, like I said. We start to see just increased waist circumference and just poor markers on these general blood work labs that we might have. We might start to see it impact our thyroid. We might start to see it impact our liver. We may start to have fatty liver or elevated liver enzymes. And then we'll start to see hormonal imbalances. And so we can start to see the effects of the blood sugar dysregulation start impacting more bodily systems, more organs, and become more severe. And so that's really what I want you to pick up on, is that the more severe these symptoms, the more likely it is that the blood sugar issues are that much more progressed. And so I was a person who had PCOS, and so this was already impacting my hormones in a big way, and I had really bad acne. And so acne is a definite sign of some blood sugar issues. It's not the only cause of acne, but that could be at the root of it. So these are things that we would start to see. And it would be this more of an insatiable hunger, and that we can't stop eating, that we feel very controlled by food, that we feel like I have a sweet tooth, like all my teeth are sweet. That used to be what I say. And these, again, beliefs that we cannot be without sugar. Maybe at the pre-diabetic stage or earlier, we may have trouble just not eating carbohydrates or not indulging because we're having the physiological issue of having poor ability to get energy to our brain. So our brain is going to send us those signals to go get more sweets, more carbs, something quick, more caffeine to put our blood sugar back up. And then when you have diabetes, this is when it's much more progressed, and you may get complications, which are these secondary complications of having these high blood sugar levels for so long, right? And so we may have issues with our eyes, or have, gum disease, or have specific skin issues, or have poor cholesterol numbers, heart disease, again, like issues with our weight and our hormones and sleep, and now it's maybe insomnia and then the depression. So there's all sorts of possibilities for what these symptoms look like. So the main takeaway from today's episode is that it starts with these early symptoms, usually when we're hungry, or if a meal is delayed or missed. This is when we start feeling that we need to eat, that we could never skip a meal, that we tend to start snacking in between meals to keep our energy up. We may be dependent on coffee or caffeine. And then things start to progress in a way where our blood sugar may be dropping more often, or maybe we're spiking it so high, we're getting cravings all the time, insatiable hunger, and things just start to snowball from there. We get more and more symptoms, more body areas affected. So this episode was just really focused on some symptoms that we may have when we have blood sugar dysregulation, and how it progresses over time, and maybe where you might be depending on these symptoms. And so I probably missed a couple of symptoms. So it's likely, like someone said to me yesterday in a message on Instagram, is it like a hypoglycemia symptom? Potentially, if I just ate and I'm not physically hungry, but I need to eat something. And I said, yes, that's actually a very common symptom. It's because your body is just not getting the energy. It's not sensing that the energy is there. This could be issues with like leptin, insulin, and then this blood sugar dysregulation. It could happen with insulin resistance, or it can happen with hypoglycemia. So there's so many other symptoms in there that just because I didn't mention it today, it doesn't mean it isn't a possibility for you. So if you do have a question about a specific symptom, wanting to know if it's tied to any blood sugar dysregulation symptoms, please send me a message. You can comment below this video, or if you're listening to this on as a podcast, you can certainly reach out to me on Instagram at Danielle Hamilton Health. And I would love to, add to this database of symptoms that we have here from blood sugar issues. So I hope this was helpful. And next week, we're going to talk more about all these numbers. So I started to talk about some numbers, but we're going to get a better idea of what numbers we should be looking for with our fasting blood sugar, our A1C, our fasting insulin numbers, and then what the different numbers mean, maybe on a continuous glucose monitor graph after a meal, things like that. So thank you so much for listening, watching, rating, reviewing. It really, really means a lot to me, and I hope you got a lot out of this episode. I will see you next week for another one. Take care. Bye-bye.